what is mass balance and what is an ISCC-PLUS certification, and why should I have an ISCC-PLUS certification as a MedTech company? Those are the questions that we are going to answer in this video. My name is Lucas Pianigonda, and I've helped over 30 MedTech companies to be more sustainable with plastics. So let's dive right into it. So the definition of mass balance, it's quite the mouthful. So mass balance is a chain of custody method that allows certified and non-certified raw materials or feedstocks to be physically mixed during the production, while the sustainable share is tracked via allocation and bookkeeping along the value chain. So the amount of certified output must never exceed the amount of certified inputs. That is the rule, and that is for a specific time period and site. So what do you usually use as an analogy is the green electricity. So if you buy certified green electricity, you cannot make sure that you will get your green electron out of your power plug, but you can make sure that at least as much electricity is produced in a green way than you are producing. So let's visualize that a little, because this is going to be crucial for you to understand what mass balance is and how this works. So this is the supply chain for plastics that go into healthcare. So we have our feedstocks on the left-hand side. We have our plastic manufacturer. We have a converter. We have a MedTech company. We have a certified product. And in the end, we have healthcare. So that will be hospitals, labs, and whoever in healthcare is using your devices. And in the beginning, you have different feedstock sources. So we have the traditional fossil feedstock that goes into the plastic manufacturing chain, and with which we are producing fossil-based plastics as conventional plastics. Then we have chemical recycled feedstock that comes from pyrolysis or that comes from gasification. And then we have bio-based or biocircular feedstock, so first and second generation bio-based feedstock. If you don't know what those terms mean, we have a whole video on bioplastics. Go check that out. We'll link it in the description. And all these three feedstocks, they feed into the plastic manufacturer. And the bio-based and the chemical recycled feedstock, those two are going to be certified. So if I only use 20% bio-based feedstock, I only can produce 20% of my plastics that are ISCC-PLUS certified with bio-based content. And then the feedstocks are mixed at the plastics manufacturer site and go into the same plant. Why do we do this? Because plastics manufacturers have billions and billions invested into these plants, and they are on a 200 kiloton to a megaton scale. So they're really, really large. They're small villages, I would say so. And it would take a lot of time and also investment in order to build such a plant. So we utilize the currently existing chemical plant infrastructure in order to process different sustainable feedstocks. And with that, we have the economy of scale. We have the advantages that those plastic grades are going to be exactly the same. So they're going to be physically and chemically indistinguishable from the current plastics that we're already using. And those are going to be drop-in solutions. Then we have the converter. Converter plastics. So that would be extrusion or injection molding. And then in the end, we have the MedTech company, which is you. And then you can, if you get certified, you can put a label on your product which says it's ISCC-PLUS certified and contributing to the bioeconomy or to the circular economy. And then in the end, you have the healthcare professionals that see that you have these claims on the product, and that will be perceived as a marketing benefit, hopefully. So what other models could we have? Like what I usually hear is that, this is greenwashing. This usually comes down to not understanding that there are three chain of custody models, and one of them is actually close to greenwashing, and one of them is mass balance, and it's not the one that is greenwashing, basically. So we have physical segregation, which is basically I have fossil-based feedstock and I have green feedstock, and those are in completely separate plants, and I can completely and all the time make sure that they are physically segregated. So this is what a PLA would be. So polylactic acid, they are produced in completely different plants, and we can make sure that this is like completely a different plastic. or bio-based polyethylene from Braskem, they are using physical segregation. So they can make sure that there's physical content in there. And then mass balance, that means we mix it, but there's still the possibility of physical content. And it's just like we produce it all in the same mixture. We can't assure that the physical content is always going to be this high, but we can assure that there is physical content and that it is possible. Over bookkeeping, we make sure that nobody cheats. And then there's book and claim. So book and claim is basically, and this is not allowed under ISCC, by the way, you use biofuel in Brazil to fuel your car, and then you don't get the credits, but the credits get sold to an airline in Europe via CO2 compensation. So that is book and claim, and that is what people usually all are objecting to. So that's certification dealing or certification trading. This is not allowed under ISCC. So why is mass balance then so dominant in plastics production? So the industrial reality is segregation isn't practical. So chemical plants cost billions and take years to build. So it's very difficult to build a separate plant, and the scalability isn't given. So mass balance models enable sustainable feedstocks to enter larger continuous plants, which makes them cheaper, by the way. And you have also the market and regulatory pressure that lead to brands and regulators demanding a verifiable sustainable content. So very often it's also about the third-party certification, not so much about mass balance. It's about having a label on top of your product. And for MedTech, very, very important is that you have the technical equivalence. Like changing a plastic towards another grade is going to be biocomp, is going to be validation and all that stuff. If you have a drop-in solution that is ISCC-PLUS certified, that's just not going to happen. You just can, it's a drop-in solution. It works as well as the other one. And you will get, from certain suppliers, you will get a statement that it says it's chemically, physically, biologically, all the same. We've tested it and you can use it in the same applications. So switch over is a lot better. And therefore, you also see that a lot of the big plastics manufacturers, when we did our market research in 2024, we found that 2/3 of the plastics manufacturer of medical grades at least have one site certified. So probably it's a little more by now. I would have to redo the whole analysis, but I can assure you that it's going to be 2/3 awards that have an ISCC-PLUS certification at least one site. That doesn't really mean that your grade is going to be available. So go check that with your supplier. But it's very prevalent in the industry, and it's going to be, I would say it's an industry standard by this point, ISCC. So let's dive into what ISCC actually does and what it actually means. So ISCC is the International Sustainability and Carbon Certification. It's an organization with a different certification schemes, and the one that is relevant for plastic is called ISCC-PLUS. So not with a plus sign, but PLUS written out. And how does that system work? So your whole supply chain is going to be certified from the feedstock manufacturer to the plastics manufacturer to the converter and you, the MedTech company. And then for the mass balance, so we'll have to have mass balance records where we write down, okay, this is incoming certified material, this is outgoing certified material. And you'll have to have a ledger somewhere that does all that accounting. And then you also need to have a sustainability declaration. So you need to certify that this product is going to be XYZ% bio-based. And those are the two key components, mass balance and the sustainability declarations, with which you will communicate along the supply chain. So all parties need to be certified. You have a yearly audit. So you make an initial audit and then you get certified. So that's a whole project on its own. By the way, if you need support, we do that. I've done it like 3 times by now. And then you will have a recurring audit. So every year you will have an audit to keep your certification. And what you can do is like you can physically mix your products. You can also have them completely separated to make it easier in accounting. But there's just the key rule, and this is also what the certification bodies want from you, is like you'll have to prove that the certified output has to be smaller or equal to the certified input per site and per time period. So you cannot sell more than you bought certified materials. And another point is that if you want to only make an ISCC claim and you do not change the product, you'll just get certified. So if you have a complete CDMO setup where only your CDMO is dealing with your product and you just sell it, then you only can have a license and sell it as an ISCC-PLUS certified product with a certain label on top of that. Those labels are all aligned with the green claims that you can make. So they make sure that there's no greenwashing going on. So that also gives you a lot of, I'd say, credibility and legal certainty towards these green claims and greenwashing accusations. So what can you do with that? So it is an independent third-party audit that helps you build credibility, prevent fraud, and increase data integrity. It makes you credible and have defensible green claims. It is a drop-in sustainable alternative solution. So regulatory and customer acceptance are much better than if you do a material change. And there's no real validation required. So that is like the big advantage. And it's a lot more scalable across the supply chain than something like physical content is. So that are all the pros for an ISCC-PLUS certification. And what do we have to do to get it? You'll have to be educated on what ISCC is, what mass balance is, and you'll have to explain that to your customers. I took 10 minutes to explain it to you, nearly 15. So you'll have to be able to explain the system well in order for it to be accepted. The first reaction will always be, oh yeah, this is greenwashing. But then if you explain it better and that it's third-party certified, it's a very widely accepted scheme, then people start to get it. You need the whole supply chain certified. That's also a big hurdle because it's time-consuming and there's a lot of effort to get the certification and to also keep it. And then you yourself have to have a robust internal system in order to make sure that you do not sell more certified material or certified product than you buy certified material. That is a whole enterprise resource planning project on its own. And you need to have ongoing audit readiness. You have a lot of effort upfront and certifications and audit costs. But in the end, these advantages that we laid out before, they make it really worth it if you want to go for more sustainable MedTech and medical devices. There's a link in the description for you because I'd love to help you. I'd love to talk to you. I did the ISCC-PLUS certification, as I said, 3 times already. So if you need help with that, just book a call and we'll talk. And if you like the video, like, comment, and subscribe because YouTube likes all those things and will show you more content like this. And I want you to have the most valuable experience on YouTube possible. If you have requests for videos or questions, write them in the comments. I read all the comments and I will get back to you. So thank you very much for watching and until the next time.